writing clinical vignettes and how to do that. So over to you, and thanks so much.
Thank you, Shara, for that very short introduction. And I hope that I'm not going to be very cryptic today and that you all will be able to follow. I am not the expert when it comes to this topic, and the resources that I'm going to share with you is basically what I use to put the 5 slides that I have together. But I wanted this to be a practical discussion and really us coming together and thinking and deciding as to how we can use and improve the way we are using MCQs. Because this is the topic of the month. We've looked at MCQs and how we use it in assessment, and Mark Allen and Shira has given us lots of information around how you analyze it and how you use the information from there. But today, because this week is on case writing, I got the instructions for getting us to write vignettes for MCQs. So this is what I could come up with. So I hope, and please come in and jump in if you want to add, want to ask a question. I might not be able to answer, but I'm sure in the group of us, we will be able to figure out how valuable this information might be. Now I need to figure out the presentation mode. There we go. So what is a clinical vignette? In its simplest form, it's literally a teaching case or a case study or a case presentation that is telling a particular patient's story, and that we want to use to highlight or illustrate a specific aspect of a diagnosis or a disease presentation or an illness or something about medicine or in the field of medicine that was interesting. And if you Google search clinical vignettes or vignette writing, then it's the synonym is literally case writing, and how they say how clinicians can use case writing for their own learning processes as well. How they use, if you find something interesting, read further why it was interesting, what is happening and how often does it happen. So we as teachers then can also use what we find in the, please don't use me as a teaching case, how not to present a new topic. But yeah, so it's you're basically using things that you are experiencing or that you are seeing in the clinical field, and then turn it into a teachable moment, if I can put it that way. If we use it for assessment, then it literally goes on to this. It requires the student to synthesize information, and it's not. If you will not be using it correctly if you are just putting information together, and that they just have to use recall, or they can find the answer in a textbook. It's easy to navigate. So it has to be in structured or written in a way that the student have to use various forms of knowing to actually be able to unpack the vignette and answer the questions that's related to that. And John Peabody has published in 2000 and in 2004 a model that he describes the structured clinical vignette that is used, MCQs, to actually measuring knowledge and for clinical reasoning. So I'm going to stop here for a moment and ask you, what is your, if you hear the word vignette and clinical vignette, what comes to mind? Is it something that you have been using or in some form or other, or is it new terminology or new things that we are presenting today? Chakani, instead of typing, please speak up. Shira.
Yeah, so Lizelle, I think that quite a few people across the faculty are used to the idea of a clinical vignette because that's supposed to be what they're writing for the single best answer MCQs. That is the dominant form of assessment in the School of Clinical Medicine. But in other schools, it's not the dominant form. And also, even within the school, in terms of basic science, to write a clinical vignette is sometimes really difficult. And so I think that there's a lot of misunderstandings about the introductory vignette that people have to write when they're wanting to ask a whole lot of facts in terms of an MCQ. So I think it's really valuable to talk about what is a good clinical vignette and how much is too much or how much is too little in terms of what you're telling the students about how to structure the question. So thanks for doing this. I think it'll be really interesting.
Well, I hope I'm going to hit the mark in the level of content. But thank you, Shira. That's what you are saying is literally what the information that I could find on writing a clinical vignette. You support that, or it's supported in the literature. Takani, I see that you've written that you have been using clinical scenarios in the assessments. Can you give us a little bit more information as to how you've used it? Was it a group that wrote the scenario, or is it every person write this scenario? Just tell us a bit more about how you use how you structure it and how you use the vignette.
So Lizelle Davy Rose is in dentistry, and I'm not sure that she's typing. I think maybe there's an issue with her microphone.
Okay.
The equipment in that corridor at the moment had all sorts of ructions
well, if
going
it's
on.
not flooding that's happening
Yeah.
in that part of the medical school, then I can understand. Okay, I will not. Thank you for typing, and we will make comments on that. So that's great. Anybody else that want to share from therapeutic sciences? I see there's quite a few of you. Janine, have you guys used it any in the medical surgery programs at all?
We tried. But I think for my Afrikaans mind, I want to understand what's the difference between a vignette and a clinical case study, or are they the same thing? So I'm thinking about it.
So you're absolutely right. It is literally synonyms of one another. So a clinical case study is a vignette. It's a short snapshot of an incident of a time period. So it's one patient, one incident. It's not a long story or with one chapter 1, chapter 2, chapter 3. So you're absolutely right. So you
we've
can put it
started
in
to
the
bring
same.
that into medicine and surgery just to make it more, not as assessment, more in terms of making it to help the students understand the theory.
Okay, so you've used it as a learning tool and not
as a
really
learning
as
tool,
okay.
Yes. And then some of the lectures, they need to fit in with this little case study or vignette, so that they can understand. But we haven't used it for assessment as such.
Okay, that's good. Thank you. So the background of the clinical vignette, it's a snapshot, like we said, it's presenting a case, but we want to use, like John Peabody was saying, that we want to use it as an assessment. But then how do you structure the vignette or the question? And this is what we will be focusing. I'm going to give you some outlines, and we can talk about the complexity of that. And then we're not a large group, so maybe we can try and write, sorry for my dogs that are barking, I'm not sure what's happening. Then we can try and write 1 or 2 vignettes, maybe as a group, or we can split into 2 groups. Janis, will you be able to split us into groups later?
So I'm not seeing Giannis here, but maybe Angie. Angie, maybe you could help us out. I don't know who set up the meeting. Could have been Angie.
Yes, let me.
Okay, so Angie, if you set up the meeting, you can split us into groups along the top of your teams.
Okay. So, but let's go through the discussion again. So the next thing that I'm going to show you is the anatomy of a clinical vignette. So basically what they are saying is that how do you structure the clinical case or your vignette before you're starting that leads into the questions that you will be asking. So they first say the first part is the patient vignette. So that's the story of the patient. And normally that you will include in there is the demographic information. The level of the details added may dictate the complexity of your question. So depending if it's just a introduction, you just want to gauge or see what is the understanding of the students, then the level of complexity or the number of information that is added to it might be limited. And the strength of association and learning when to use the evidence will also determine what information, so what type of questions you want to ask, what is the objectives that are linked to it. You will then use, you will structure or provide the information in your story or in your little vignette about the patient so that the student will get enough information to be able to answer the questions. They say a clinical vignette applies to a single patient and the information given mimics what an expert would extract from a history, physical exam, and ancillary testing. It might not help the student to use rote memorization questions, but it has to guide the student to synthesize information easily. So yeah, then it leads into, it ends with a lead in. We always say that we have to link things. So this then goes into the question. So what is the type of question that you want to ask? Is it focused? Is it closed? But it has to be clear as to what you want to achieve to the lead in question. And they say that when you are structuring your question, it has to be logical and grammatically correct. And this is where my Afrikaans brain is normally failing me, because I feel that students that will be able to answer my questions based on language. So it might be a good idea to get somebody else to read your questions to prevent that, or to overcome students that are acing exams, to prevent them from guessing the answers. And then how you structure your options, the answer options, there has to be choices, and it should be tailored, similar. They should be similar in you know, the choices here. And then the distractors, the incorrect answers should be having not the best answer. If using numbers and letters, place them in order and use the same format for all your options. So don't make it easy, like I was saying, for people to guess by how you are structuring your options or your possible answers, that they will be able to guess your choice. And then the rationale for why you've included, or why you've asked this question, is maybe important, because that can generate discussion if you're using it as a teaching tool. But also, if you are able to explain why a distractor is incorrect and why the answer is correct, it will make sure that your it will create validity of your question, and it will underscore that it's got a place and there's a reason why it's there, and it's more valid. So, any questions so far on the anatomy of a clinical vignette, how it's been structured for use to structure a question? Okay, we are going to practice this just now. So let's go on to, so the vignette construction. So the STEM, that's basically your patient demographics or your patient details or the patient story, begins with an introductory statement with demographic information. So it can start with a 22-year-old woman or a 3-year-old child or a male neonate. It then continues with a specific time frame. So it can say, comes to the healthcare practitioner or the physician or the doctor with a 3-day history or a 10-year history of, and then presenting the main complaint or the complaint. You can include some physical examination data, and it speaks to your subjective and your objective data. Objective data from testing, and it ends with the lead-in statement asking a question to be answered. So that goes into the next step. Any questions? Any comments? Are we still on the same page? Hands up. Okay, I'm not sure if anybody can hear me still because there's silence. Thank you for the one heads up. Okay, so the vignette, one of the resources that I will be sharing has created a vignette worksheet. And it's basically just giving us more information around what information. So if you have this worksheet and you want to create your question, then this is maybe a good starting point, having this table. So you will have your patient gender, age and gender, the site of care, so where is it taking place, setting the scene. You will have a short sentence around the chief complaint, presenting the complaint. It's, when did it start? What is the nature? Duration of symptoms, so including the changing of symptoms, or is it radiating anywhere? The pertinent history, so the medical history of the patient, so that's relevant. So you can include allergies and social habits, and then examination findings, results of diagnostic studies if it is required for the level of testing, and then the response to the initial treatment, also if you want to include that. So Janine, you were saying that you are using cases for teaching. Is this basically the same format that you've been using when you're writing your case?
Yes, it does look like it.
Anything that you've added or that you did not add in? Sorry, I'm picking on you.
Sorry, I'm just quickly going through it. No. No, not that I can think of this quickly.
Anybody else that have written a case or cases or scenarios for questions? And it can be an essay question or anything that you've written a little story before you've asked the question. What kind of information did you add?
So Lizelle, I wouldn't mind just jumping in here to say that your list there is very comprehensive. And I think it's really good because it's a checklist so that you can see if you've left out essential stuff. But sometimes what happens is when you use a checklist, you put in information that is unnecessary for the question. And so the student gets all this information and you don't need all of it for the question. Like, for example, if there's no impact of allergies, then if you've asked the question about allergies and you say the patient's allergic to peanuts, but that's got nothing to do with the clinical question that you're asking, the students, because they're reading through all this extraneous information in a really good case and they know all about the patient, but they don't need it for the actual MCQ. So I think that that's something we need to think about when we use checklists in terms of structuring a case.
I think that's a very valid point, and if you there's one of the worksheets that I've added in as resources for your that I will share the PowerPoint later, that you can have a look. And it's literally you have to decide as when you're writing your vignette that you're not that the information that you include is valid and it's not distracting or are taking away. So Shira, you're absolutely right by saying that that yes, having this might be seen as a checklist, but you can give too much information. But it's at least a starting point to say that if I want to ask my question, did I give the relevant information moving forward? And then when somebody is reading it and when you're discussing it, you can then say, you know what, we don't need the duration or the pertinent history because we actually don't expect them to make a diagnosis. We will be giving a diagnosis. So it all depends on the objective that you want to use the vignette for, as well as what is the type of question that you're asking. Am I speaking the right language? Shira?
Yes, so no, so I agree completely. I think that what you're saying there is about also the quality assurance. And it's interesting because when you design a question, you think you've said everything that you need to, and sometimes you've left something out, so the checklist is useful. But also sometimes you think something is key information, and then you realize when you actually ask the question that it's not. So it's really good to have other people read your cases or your vignettes once you put them up, so that, yeah, it can be a group decision rather than just, you know, thinking that you've written the question according to the specs and that you might be a little bit off.
Great. So the first part, you can see the vignette is in 4 parts. It's the story, and those are the general information that you can include to guide your question. Then it comes into the lead-in or the actual question that you're going to ask. So which of the following or whatever question you're going to have, structured in a certain way, and then you have your options, option A, B, C, D, and E, and then we get to the final part, the rationale. And I think this is the most important aspect of writing your or developing your questions is you fill in this blank of the correct answer is option whatever it is, and this is why, give a reason as to why it is the right answer or the best answer for the question. And then for each distractor you have to say this is incorrect because, and give a justification. And when somebody then reads it or go through it or try to answer it, they can then actually say, but this information was too much, or it distracted, or it confused me. And when you read your own rationale or think through your rationale, it will also then guide you as to, am I on the right track? Am I actually asking or assessing what I want to assess, or am I asking the questions that is related to the scenario? And do I meet my objectives? You know, so the constructive alignment coming in again. So this part is key in making your justifications. And I think sometimes this is where we fall flat, is that we write our answers in our mind, but we never go back and reflect on why did or do we actually have the best option when we are setting our assessments. Any comments on having this rationale aspect in our thinking process? I want to say this is my last slide, so we are going to go into groups after this in trying to write our own vignettes. So any discussion will be good. Questions? Okay, so we've got about a half an hour. Yeah, I think 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Can we maybe break into 3 groups? And then in our groups, we will then, as a group, write a vignette for, you can decide on what is the topic for your group. And then maybe we can do it within 20 minutes, and then we can give feedback in the last 10. Does that sound good? Okay. Thank you, Matty. I really appreciate it. It really feels like I'm talking to myself. It's yeah, scary. So we will be going into groups for maybe 50, yeah, 20 minutes. Hi, I see that you're all slowly but surely coming back, and we've lost a few people along the way.
Yeah, there's load shedding in our building. So Janine says that the electricity and the internet went off in the Kanya building on campus.
So we were only 2, Keenan and myself in our group, and I must say I found writing this vignette very difficult. So I don't know if you just want to talk about your experience and how easy you find it, and you know, what is the challenges? Maybe give some feedback on how you find trying to write a story in 20 minutes. Who wants to start?
So let me start. We cheated. So I'll just say it right off the bat. We cheated.
Don't feel alone. I think all of us went and find the cheat sheet.
So we used a case that we've used before in an exam, and yeah, we let me just try to find it so that I can share it.
So while Matty is looking for that, does anybody else want to share their thoughts? Seeing that we using sheets, how easy is it in any case to adapt? Oh, Matty is back. Thank you, Matty.
You know, we had a discussion about the fact that as occupational therapists, because we were 3 happy OTs in our group. I don't know whether Jonas did that on purpose, but our cases are often rather different because we don't necessarily have all of these super duper medical stuff and medical assessment-y kind of tests and whatever. But if you look at Mrs. September, there's a lot of information that could look like unnecessary information, but this question we used for the 3rd years who do labor law. So our 3rd year students learn about labor law, and because they have to understand the key principles of labor law in order to be able to advocate for patients, and in order to recommend appropriate reasonable accommodations for patients or for clients in the work context that would be appropriate not only for the client but also for the kind of employer. So if you look at the information that's contained in this vignette, the company employs 10 people. So that means the students must know that it means that the company is not a designated employer. So they need to tread lightly when they start making recommendations for snazzy, reasonable accommodations, because an employer does not have to make those expensive kinds of RAs because they're not a designated employer. So yeah, so we used this case on purpose because we we are different. Our profession has to focus on different kinds of things. So Liz, I don't know whether it meets all of your requirements, but we thought that it does.
No, but this is actually good. So if we have to set criteria as to how we are judging or evaluating a vignette or a question based on that is using a vignette, would our that little table, the four aspects and the rationale, if we have to report on that, would our questions be improving, or do you think we are just adding additional work? Can we actually quality assure our vignettes or the questions, how we write this? Should we quality assure this?
So Lizelle, that's a question into the ether, I think, because I personally think we really should be quality assuring our questions better. I think that people write questions in a hurry and they don't let their colleagues read them, and there are elements which kind of make it through that shouldn't or that aren't there when they should be. And I think we definitely need to have some kind of expert opinion on whether a question works or it doesn't work. And so whether that's by a rubric or whether that's by people being in the field, I don't know. But I do know that when I've seen people trying to do, for example, standard setting using one of the expert opinion methods, they'll take people from other specialties and do the exam and say, but what we're trying to do is train generalist students, and therefore any person trained in this field should be able to answer the questions. But they miss the subtlety of it because it's not their arena. So what Matthew says in terms of having a question that is very much within their scope of practice, it's important then that someone from their scope of practice should say whether it's a good question or not, if you know what I mean.
No,
so yeah, I think it's a very difficult one because people write questions very late and they hand them in late, and so people who collate exams land up just putting them in, and when students don't perform well on questions, well then it might just be because the question wasn't maybe set up as well as it could have been.
So I think you've raised a very important factor, and Matty, please join in the conversation. We've got 2 minutes to go, and I'm so glad that all of you stayed until the end for this session. But yeah, Matty.
Shira raised a very, very important point. And yes, on one level, we are training generalists. But a generalist occupational therapist is different from a generalist physiotherapist and a generalist medical student. Medical students don't need to know this labor law kind of things. And I had a very long think the other day when I reviewed a paper for a colleague at the University of Pretoria. Because the vignette that I disagreed with some of the things that she put in her vignette because I thought that some of the things were incorrect. She made a couple of assumptions that in my view are incorrect, and that also at an undergraduate level, the level of complexity of debate that question ought to elicit is wrong. It's a level of debate that should be elicited at a postgrad level and not an undergrad level, and because the complexities just are too many. So I think that it is very important that we benchmark not only within the university but also with our counterparts at other universities, and with the University of Pretoria specifically, we are, well, I am trying to find ways for us to better collaborate. I mean, there's 3 universities that train occupational therapy in a 100-kilometer radius. So why are we not talking to each other more about this kind of thing specifically, so that we can benchmark, so that we can learn from each other, and that we can help each other? And because we all have the same time constraints.
Matty, you are raising 120 points that we need to touch on. Shira, over to you.
Yeah, so I mean, I think that that's part of what the Rationale collaboration is about. That that we should be working together with others, and that the more the merrier, actually, and especially from different institutions, so that we can say, um, what a standard for a profession would be.
I like that, because seeing that the Rationale is setting the wanting to create a question bank, and maybe we should have a question bank for vignettes, and then have a standard of reviewing or quality assuring. And maybe that's a group or a discussion for a next time as to how do you set criteria for the various types of questions to quality assure that we are all standardized in our way of doing. Janus.
So just on that criteria that you were just speaking to, the quality assurance discussion I've had with you previously, which we are doing in the Department of Family Medicine, as Richard raised this point in terms of that we need to make sure that the exams or assessments that we're giving to students, all assessments needs to be quality assured, and before we deliver it, and then obviously looking at student performance afterwards. So we've been workshopping, the QA process for how do we deal with the assessments in the department. And one of the things we've identified specifically is that the different types of assessment actually needs to follow slightly different processes, because the criteria is different. So yeah, and then that's something that we can build on. But it is the actual workshop. The next workshop is actually on Friday. I just remembered I need to include you in that. And then maybe it is something that we can open up to the faculty and for people to look at and critique and sort of come up with something for the faculty and not just the department.
I think we should all be creating working groups and having unpacking setting criteria for evaluating different types of assessments, that it's not just and like Matthew was saying, going through the broader and having the other universities as well. And I know that I've stepped 3 minutes over 5, so I think thank you for the bitter enders and for joining the session. I appreciate that. And I think this is maybe a conversation that we should take up on a next, when we are doing our next case writing session, as to how do we quality assure and how do we evaluate, does it meet the end? Thank you. Any last words from anyone?
Thanks, Lizelle. No, nothing else. Kim,